Hi, everybody. This is Mike Lappin at Colorado State, and my friend.
Margie Scherk. I'm in Vancouver, British Columbia.
We were hoping that we'd be doing this together in the same room, so we're wearing our masks. But since it's electronic, I guess we can probably take it off.
Darn. Oh, now I can breathe again. Hooray!
Yay. Well, hey, we're here today representing the American Association of Feline Practitioners and wanted to give a bit of an update on the COVID-19 situation in people and how that virus relates to cats. Margie, did you have any introductory comments that you'd like to make before we get started with the updates?
Well, I think that I'm delighted, really grateful for you for doing this because this follows nice, it segues very nicely after the Zoonoses Guidelines, which were great, by the way, you and team, way to go. It really is putting the zoonosis situation firmly in our faces as people are scared as they hear about all of these this cat test positive, this mink test positive, this ferret test positive, this dog test positive, and people are getting really scared about it. And so I was really, really glad that you were going to do this to help bring some reality and some calmness to the situation and tell us about where do cats fit in this picture as far as we know today.
I love the today part. So what we've decided to do at AAFP viewing audience, what we're going to do is I'll probably kind of lead the discussion, boom, boom, boom. We're going to try to keep within about 30 minutes with probably 20 core important topics in our mind. Margie's going to interject where it fits the best from the AAFP standpoint, especially with some of the welfare issues on the indoor-outdoor stuff towards the end. But with no further ado, I think we both agreed that you don't need to stare at us all day long. So I'm going to go ahead and turn off my video until the end. I'll see you with my face later on. Perhaps Margie will do the same. And here we go. So guys, I've been really, really fortunate to be involved with the AAFP for a couple of years now, as you can tell from my gray hair. And I'm very proud to be the student chapter advisor here at CSU. And it's really great to see national and international organizations working together on things like global pandemics. Margie gave the lead in. Thank you again for letting me do the labor of love, the update on these guidelines. And I still feel horrible that they took about 3 years to get finished, but I did still beat Susan Little because we got these out before the retrovirus guidelines.
Just under the wire, just under the wire. I'm gonna stick up for Susan on this one.
It was days, not weeks, right?
Mm.
But bottom line is, when we put this committee together, when we started these guidelines published in at the end of 2019, we didn't actually realize we were going to be in a global pandemic just a little bit later. So this one has been a opportunity for us to share with you what WSAVA is saying, what OIE, what CDC is saying, without having to try to update the print version of the guidelines. Again, these print versions they're not very nimble. So we're hoping that this little webinar will be of interest to you guys as a supplement to our Zoonoses Guidelines. Margie's already given the disclosure, but I'll reemphasize it. It was amazing. I thought I had this talk ready to go yesterday, and then the possible mink to a human paper blasts up. So I actually had to update the darn thing even this morning. How this ties into WSAVA, I happen to be the chair of the One Health Committee. We've lost our founder recently, Michael Day, to illness, and we're all still in mourning. But it was a great committee to get started because we're so fortunate to have a representative from the CDC with Casey Barton-Baravish. We've got Gregorio Torres from the OIE. So that helps a lot because these guys are quite responsive. If we have a question that we don't really know how to answer yet, we have the strength of those two organizations to help us make our recommendations. And once it's time to make a recommendation, this group It's 113 associations with greater than 200,000 vets. And so that's been, I think, a great way to disseminate information, which we're, of course, trying to do also through the AAFP today.
And I'll just interject there briefly, if I may, in that the reason we're not doing this through the Journal of Feline Medicine and Surgery is specifically because it has to be a living document. It has to be a living, changing conversation minute by minute.
Yeah, that's a really great point. Hey, and I think we all have our favorite websites, but there's so much information these days. I've personally just kind of narrowed it down to hanging with about 6 of them, 8 of them, with obviously being an AVMA member, an American, having a link from WSAVA to the CDC and OIE, and then WHO is still a great organization, good, accurate information. And if you love to get those morning updates of what's getting ready to hit the mainstream media, ProMed is fantastic. And then I'll also want to acknowledge my partner in crime with ISCAID, Scott Weiss. I don't know when the man sleeps, Margie.
I don't think he does, actually.
It's crazy. You Canadians are amazing. But I just have to get up in Colorado because I'm 2 hours behind him and see what's already been blogged by Dr. Weiss. Why I am very complimentary of Scott, internal medicine specialist, a very balanced individual. Again, it's blog activity, but great information, gets things out early. And then Scott, myself, Jane Sykes, a number of others, we did decide about a month ago to start offering some opinions from ISCAID as well. But before I get to that, I wanted to show you a picture of Michael. Again, we miss you, my friend. What we're doing at WSAVA is about every 2 weeks, kind of giving a updated version of what's happened recently. We can be nimble enough to do that on a day's notice if need be, but generally it's 1 to 2 week intervals. So check out our site if you'd like. And then we did just launch our COVID-19 materials for ISCAID. And so we do have frequently asked questions for owners, frequently asked questions for vets. And then we've started a new part of this called current issues. And our first current issue was actually about domestic cats. It was posted about 10 days ago. I'll be able to update that for you here as we go through the document. So now I have 4 dogs, 4 cats in my bed every morning. So I'm getting ready to have a little pet-associated throat clearing. So I'm going to mute for a second. And Margie, if you'd like to just say a few words about AAFP interactions with other groups like ISCAID and WSAVA, and I'll be right back.
Happy to. So the AAFP has been very open to interacting with other groups on this, as well as other things. So it really wants to keep its members up to date and able to help. We want to be able to help our patients the best we can, as well as our members.
Yeah, and it's really nice because we do have a lot of crossover amongst the 3 and 4 groups, if we include the ISFM, our friends and family on the European continent. We all work closely together. Okay, well, let's do just a quick updates. And most of this I know you know, so I'm going to go boom, boom, boom. And so first step is to make sure that your owners realize that these are not the enteric coronavirus of cats or the FIP coronavirus, total different group, the beta coronaviruses. And we do have some experience, unfortunately, with these bugs, with the COVID-1 that we saw back in the 2002-2003 time period, that short-lived MERS, more of an epidemic, more so than a pandemic. But this new one, gosh, again, get the terminology straight. The virus is SARS-CoV-2. The human disease is COVID-19. It's totally a separate group of bugs. And as we go through the updates today, we will kind of bounce around a little bit, mentioning antibodies, mentioning virus isolation and PCR. But just remembering, if your body made an antibody response, you probably were infected. You know, we say exposure, but to get past the mucosa to actually make antibodies, most of us would accept that means that animal had been infected at one time, but it certainly doesn't prove that you still have the virus. Where we get a little confusion on isolation or amplifying nucleic acids is, remember, isolation means you got live virus still there. And so that's really the best gold standard for saying, is this person, this cat, this other mammal, are they currently infectious? That's actually best proven with virus isolation, but that's not widely available and generally requires BL3 type laboratories. So most of the work is started with the great reverse transcriptase PCR, and you'll see it written with a Q, quantitative RT-PCR, in most of the writings. But we do have to remember that doesn't prove you have live virus. Now, if a cat's repeatedly positive for nucleic acids, it probably is infected. But when you start looking at say some of those first cruise ship papers, they were finding RNA on handrails for like 17 days. And that made people fear that it probably lived on the handrails for 17 days. Well, that turns out not to be true. The nucleic acids are still there, but that didn't prove live virus. So keep that in mind as we go through, and I'll try to emphasize some of those important points. Those of you that are old enough as veterinarians to remember, cats were actually part of the whole SARS-CoV-1 with some of the work that was done in Hong Kong in particular. So we've known that these beta coronaviruses would be potentially infectious to our cats. Thankfully, that stayed more as an epidemic, not a pandemic. And honestly, a lot of people kind of quit paying attention to it until December 30th. I don't know where you were. This is kind of like, where were you when JFK was shot? Those of you that are old enough. Bottom line is, look where this was. I was at the bottom of the Grand Canyon. I don't know where you were, Margie. Do you remember?
I actually don't.
Okay, well, I tell you what, I was at the bottom of the Grand Canyon, and then it was a couple of weeks later before I actually recognized that something was happening, like probably the rest of the world. But look at the numbers from yesterday. Is that crazy? Yeah, that's a pandemic for sure. And so it's really important that we talk about this. So a couple of quickies. There's always the question of, where did it come from? And I think the wet market in Wuhan, probably bat meat associated, does make the most sense. Whether or not there's a bridge host like this nice paper about dogs is still going to be debated for a long time. But I did want to just point out that nobody in our groups think that it's a clinically important issue. It'll be great to learn this over time, but the jump host probably isn't as important as do our animals that we care about, potentially snuggle with. Again, 4 of those 8 animals in my bed this morning are cats. And so this got a lot of the attention quite early, the ACE2 receptor work, and another great paper just last week. Obviously, this suggested that our favorite species, the cat, was going to be a permissive host. So I got pretty excited about this, Margie. I'm assuming you did as well, because wow, something might be getting ready to happen. This is just, 2 months ago? Crazy. Well, a lot has happened. You know, the Hong Kong people, and we've been lucky, a friend of the family of AAFP, Vanessa Bars, has been able to keep us updated all the time on these 30 dogs and 18 cats and 2 hamsters. This was kind of that famous cat, the first one that was PCR positive multiple times, ultimately did make antibodies. But I did want to show you, because this will come up as we go along later, what is the risk? Well, these are cats that were living with people with proven COVID-19 associated illness. And even though they were living with those people in a very crowded city, only one of those cats ultimately became positive. The 2 dogs, they got more press probably than anybody in the world at the time. Those 2 dogs actually became a nice full paper that just came out last week. And of course, now that we're testing a few more animals, we're picking up some of the inferior species as being positive with the pug in North Carolina recently. But again, we do have a favorite species today, the cat. And so Scott Weiss and myself, others, we were kind of laughing about this the other day, is obviously since the numbers of proven infections were small, there basically was a press release and or then a ton of media coverage of every single animal. And in fact, in our ISCAID document just posted 10 days ago, we were still listing them one by one, and then boom, we have a German cat, then a cat living in Spain, and then, gosh, 3 days ago, they reported the 3 cats that were living in the mink farm area and a dog. So, honestly, guys, this is I think, a place to take a deep breath, and so I'll do that, and say it's already proven. We know that it's a reverse zoonosis. Having a posting for every single individual cat from this point forward is probably a waste of electrons. It's already known. You can, if you are a human with SARS-CoV-2 and you're currently spreading it into your environment, potentially endangering your family, you also can infect your cat. So we just need to just get over that. There are going to be more reports because the tests are more widely available now, but this is a reverse zoonosis. But that's where I keep reminding our staff here at the teaching hospital, just keeping that in context. Again, I know we haven't tested very many cats yet, but this is still a human-to-human disease that the cat could be infected. Now, let's talk about this for a second. Scott has blogged about this already as well, but this report out of the Netherlands, back to that mink farm, that is a permissive group of animals in the weasel family, ferrets as well. We do have that concern of animal-to-animal transmission, and during the time period that they might be shedding the virus, could it go back to a human? Well, until this report just yesterday, nobody has reported any convincing information that that could have happened. And in fact, many of us are now discussing, is this posting a little bit premature? Because the problem with having a person infected, say, on a mink farm that has the organism going right now, how do you really know they were infected at work? Couldn't they have been infected at the grocery store 2 days later? So Margie, I don't know what you felt about this report, but I think we need to probably temper our fear.
I think we really do, because we've got, first off, we don't know genetically, we don't know the gene sequences between the, while the report suggests that there are similarities in the gene sequences of the virus from the mink and from the person, but it still doesn't tell us who infected who. And because it's possible, as you said, that the infected worker got it from somebody else, and then gave it to the mink. And so we really don't know what the direction of this is yet.
Yes, and I think all of us that are practical, I mean, I don't want pets that are infected by their human to then give it to someone else. And undoubtedly, it probably will happen sometime. But that's not the norm. The norm is person to person. And as we'll talk with the experimental data here in cats to follow, the shedding periods of live virus are actually fairly short, and thankfully fit within our home sequestration. If you have a family member that's infected, keep it away from the other family members, which include the cats. Mm-hmm. And then hopefully it'll all be done in about 14 days.
Yeah, and Scott's also suggesting, and that, sorry for interrupting, Scott's also suggested on his blog, and as well as on in the iScape blog that you're involved with, is that cats who are living with people who have the clinical signs, or I guess in the case of people, we can use the term symptoms of COVID-19, or who have tested positive for COVID-19, that those cats, those are cats we do want to consider keeping inside, so that they don't come in contact with other people outside. And I think you'll probably touch on a bit more on that later, eh?
Yeah, I think we will definitely come back to that in a few minutes. Hey, guys, I'm really of a domestic cat kind of guy personally, but this was an interesting group of writings, and you probably saw the follow-up postings just back on April 22nd, that this is evidence of cat-to-cat spread. Obviously, the zookeeper that was thought to be the primary source of the virus to these cats probably wasn't closely snuggling with all of them. And so there is a little bit of information suggesting a cat could then infect the next cat if they're in close proximity, like in an exhibit in the Bronx Zoo. But I do always remind people here before we go back to domestic cats is these guys often have a little bit more narrow gene pool just because they're so endangered and so few in numbers. So I think we should always caution our interpretation of non-domestic cats and how that relates to what might be sharing the bed with me this morning. And that certainly wasn't a tiger. But moving on, gosh, you know, we were hoping that it wasn't going to be true, but it's true. Cats, dogs are pretty, cats and ferrets are pretty close to a human. Dogs are a little bit harder to infect. And so it's for real. The first report out of China, and then our nice, great paper from just earlier this week from Wisconsin. If you give enough virus to a cat, you can infect it. If you then have a naive cat exposed to those primaries, they can become infected, and this is virus isolation. But look at the time of shedding, guys. And this work has been replicated at Colorado State. You will see the publications, not in my lab, but here at the university. You'll see some further information coming that's been shared with the deans around the country. We even now know from the CSU work that it pretty much stops. And then CSU has actually done a challenge study. 28 days later, they're still immune. So that'll be a really great report from the Bowen lab that you guys will see later. But we need to just quit saying, oh, do they get infected? Well, the answer is yes. The question is, how easy is it? That answer seems to be, they're fairly hard to infect based on the Hong Kong experience. And then the next question, obviously, is since coronaviruses do both GI and respiratory, is that potentially important? Well, I guarantee over the next few months, guys, you're going to see a lot more herpes cats than you see cats that have SARS-CoV-2. So now we're going to have to talk about PPE at the end today, but we are trying to conserve our PPE for use in true at-risk or high-risk animals. And so we did a DISCAID in our report last week, suggests that if they've had mild clinical signs, which is what appears to be happening in field cases as well as experimental cases, if it's lasting over 14 days, it's probably not SARS-CoV-2. Thanks to our friends at Antec and IDEX for sharing their data, and it's well over 7,500 pets now tested. And as you guys know, those monitoring programs have only picked up the 2 cats to date. This is one of my favorite ones since I also teach vet students. If you guys didn't see this report, these 9 cats that were living with 2 proven positive vet students. And of the other 18 students in that kind of same compound, 11 of those other students had suggestive symptoms. Well, guess what? It's not that easy. All those animals remain negative. And so that's why I think when you kind of start looking at all the data, do they get sick? Well, maybe, but it seems to be short-term and self-limited. Do they get clinically ill and infected often? It seems to be in that 5 or 6% rate if you look at the Hong Kong data. So again, it's back to getting into the odds things. Is, well, the odds are a cat that comes in with URI or vomiting and diarrhea probably has the same stuff that we've been diagnosing and treating our entire career, not this virus. Unless it came from a mink farm that has current infection, unless it came from a family that has current infection clinical signs or suggested clinical findings. And so that's probably why the USDA, other countries have been limiting who gets to test. Again, if we go through the Colorado State Diagnostic Lab, for example, which is perfectly capable of performing this PCR, it's hard to get permission. We haven't given a single clinician permission to test a cat yet because Larimer County, Colorado is not New York City. We don't have as many positive people. And unless that person or that family is strongly suggestive or positive, we can't test these animals. And honestly, if you really look at testing, we need more testing to help prove epidemiologically what all is going on. So all of us support well-designed zero epidemiological and PCR-based epidemiological studies. But honestly, guys, by the time you get through getting approved to test, or even shipping it off to a lab that would do it without approval from your public health vet, bottom line is by the time you get the results, most of them are probably already well if they were ever sick because of it. As we all know. Yes. Yeah, please come on in, Mark.
Can I just go back to that point? That another point that from the ISCID committee, because I think it's worth emphasizing that you talk about we shouldn't even be considering it unless somebody's had upper respiratory signs for a cat, that is, has had upper respiratory signs for at least, or for more than 14 days.
Yeah, if it's longer than 14 days, we know it won't be SARS-CoV-2.
Right.
So, yeah, right. No. So I, as a clinician who cares about cats and want to learn, I want to learn epidemiologically. But since we don't have treatments for this virus, it doesn't really matter. And so right now, there's not a lot of reason probably to be testing many of these kitties. Okay, a couple of quick more points. We'll get into some PPE discussions. We'll have a little blathering between Margie and I and let you get back to the clinic. But we did want to reemphasize, and we did this early in the pandemic, that even though there is a feline coronavirus vaccine in some countries, there's no indication for administering it to try to lessen illness or shedding of SARS-CoV-2 virus. It won't work. And of course, there have even been people wanting to vaccinate themselves with dog enteric coronavirus vaccines, for example. It doesn't work, guys. So please don't do that. It's not going to help your cat, and it's certainly not going to help you.
And that comes back to the alpha versus beta coronaviruses.
Yeah, great point. I love this one, the whole bathe and or disinfectant wipes. I understand folks were hoping to lessen the fomite transmission issue, but as the CDC and AVMA co-developed with input from the shelter group here in the United States. Just a cut and paste statement from that document. I kind of support this one, Margie. I don't know how you guys are feeling in Canada. How are you guys on this?
All you're going to do is can I use the term piss off the cat and disturb them and also run risk for yourself of getting hurt by the cat.
Yeah, yep, and then stress associated might worsen the herpes that it was shedding to begin with, because it wasn't actually SARS-CoV-2. So yeah, I'm not bathing any cats personally here at Colorado State. All right, this was was this a hot topic in the UK last week, Margie?
Yeah, it was actually, I think it was, actually I think it's back in April, but the BBC, British Broadcasting Corporation, had published a story containing a statement that recommended keeping cats indoors during the pandemic. But right immediately, the same day, the British Veterinary Association clarified their position and said that they really do not advise that all cats are kept indoors, that only cats from infected households or where their owners are self-isolating, and only if the cat is happy to be kept indoors because of the stress of keeping cats indoors and how that's risky to them. And then the International Cat Care put out this blog, which is a very nice blog, and it comes in multiple languages, about not keeping your cat indoors because some cats simply can't adapt to it. And of course, there are halfway points, like you have a fabulous catio for your cats. You built that with your own hands, I believe, Mike.
Yes, yes.
Your hands may never be the same. And so that this is, and again, it comes back to us needing to teach people to provide species appropriate indoor environments. Back in 2016, the AAFP actually published a position statement on the impact of lifestyle choice on the companion cat. And Dr. Scott Weiss, who we've mentioned many times, wrote about that in his Worms and Germs blog, that it's and I'll just read from it. It's a complex situation, and I know I'll get strongly opinionated comments in response to this topic. In my perfect world, as an infectious disease person, all cats would be indoors, but not all cats fit into my perfect world. So I think the default should be keeping cats indoors whenever possible, both for their health and the health of their families. That's particularly important when the people or cats are at increased risk of disease. But, and remember, this is pre-pandemic. Some cats won't do well inside 24/7, and some allowances can be made for them as well in the right situations. The indoor-outdoor decision needs to be made based on a large number of factors, and there's no single approach that works for all cats, households, and regions. And he also said that at that time he had 3 cats, only one of whom was strictly indoors.
Yes, and you know, Scott's opinions were then re-echoed by Scott, as well as the rest of our committee from Miscade, where we did feel that both should be factored in. Obviously, perfect world, indoors would be fine, but I kind of like that second to the last sentence. I haven't seen a lot of cats outdoors that go running up to coughing people for a big snuggle. I don't know about you, Margie.
Yeah.
Yeah.
My
So
cats generally run if somebody comes.
yes. Okay. Well, last couple things for today's short update from the AAFP, Margie Scherk and Mike Lappin. Scott, again, he's just a trendsetter. It was really great to see Clinicians Brief publish this first algorithm that we've all probably spent time reading and building from, the updates from the OVMA and the Canadian VMA. Obviously, AVMA in the United States has a great algorithm as well. What I would recommend to you guys as an interested group is look at all of those different guidelines and then make what fits with your practice with, again, our goal at CSU, and we want our staff to know this, is our first goal is to keep our people safe. That's why we're asking screening questions, is we want to decide which of those animals, which is almost none of them, but which of those animals would be more risky once they come in the building. Right now, we're in the safer at home phase in Colorado, which there's a little bit of relaxation of people coming out and about, but we are still doing parking lot service. We're not allowing people into the veterinary teaching hospital at this point. And so what we're wanting to do is make sure that we don't share our viruses. And again, as we all know, face masks don't protect the wearer, but keep the wearer from spreading their droplets to others. And so again, our guidelines don't necessarily fit with your guidelines, but we just encourage folks to think about it because it's people to people. And then when you might have that rare cat that was infected by exposure to a person, especially if they're having clinical signs, especially respiratory, because it's easier to spread, then you might, with those 4 questions now, these are CSU's pre-screening questions that we actually like being asked just when they call in, and then we ask them again before they even leave their car, because once we know the answers to those 4 questions, then we can develop our what to do with them once they're in the building. Because as we all know from the start of this pandemic, we need that PPE to be used appropriately, because if everybody wore an N95 every 2 hours, then we don't have enough N95s. And so, as you can see from CSU's guidelines, we're actually trying to keep us from mistakenly bringing a virus to work. We do our pre-screening questions. We all take our temperatures daily before we come in the building. And then we wear our standard PPE to avoid transmitting things from each other. And then, of course, you tie in the patient. Then we still do our hand washing. We still do our 2-hour smooth surface disinfectants. And if we need to get closer than 3 feet, again, holding a cat while the other person's bleeding, for example, we still stick with the eye protection because of the potential droplet transmission between people into that mucous membrane. That's been relaxed in some guidelines, but we chose to keep that here at CSU for those times we have to be hovering over the same patient at the same time. And then depending on what's going on with those first 3 questions, the owner questions, you know, once you start hearing there's somebody in the family, yeah, somebody in the family, so we pop down to those answers, yeah, then we upgrade. And that's up to each of you to decide. Not everybody has PAPRs in their clinic, but appropriately self-fitted or officially fitted N95 is definitely should be upgraded, especially if the owner's sick, the cat or dog is sick, and you have to dropletize it. But you know, you can avoid most of this because a lot of the procedures don't need to be done for the 14 days. And so we actually try to get cases in the building basically only if they need it, if they're coming from a COVID-19 family with a history of clinical signs still within that 14 days. And hopefully if we do all those things, we're going to lessen transmission amongst people, and all those researchers will hopefully give us vaccines and things in the future. And we'll all be doing these updates hopefully again in person in the coming months to years. So thanks a lot, Margie, for letting me chat with you today and the group. Other closing remarks from you today?
Thank you very, very much for doing this. I think this will be really helpful, along with some of the misinformation that's been going around. And again, coming back to alpha and beta coronaviruses, there was even a suggestion that being exposed to cats, thanks to their natural enteric coronaviruses, that they may give those of us who live with the superior species a benefit and some degree of protection. Unfortunately, again, coming down to the epidemiology or the virology rather, that's simply not the case. Too bad. But we get all kinds of other advantages from these gorgeous kitties, including having a chance to work with you, Mike. Thank you so much.
Oh, thank you too, Margie. And hey, turn your video on one more time. I got to see you before we sign off.
Where is it? There's so many screens. Here we go. Yay. Should be showing up there soon.
There you are. Margie and I were laughing earlier today. I haven't been to the hairdresser in greater than 8 weeks now, and I'm not going. I'm one of those risk group people, so I'm not going. I'm going back to the old Lappin days.
Yeah.
Looking forward to it.
Yeah, I hear you. And this is hairspray. So there you go. Something I've never bought before in my life.
Well, thanks everybody. Signing off now.
Well.
We hope to see you.
And wear your masks when you're around other people and unable to keep distance from each other.